Sorry. Thank you for joining the On Her podcast presented to you by Euskaya. I am one of your hosts. My name is Dr. Flavia, the Executive Director for Euskaya. I'm here today with Dr. Desouza, our special guest, Mary Moody, and Anna Aforka, my co-host. As you all know, Euskaya aim is to advance the health of African immigrants. That is why we continue to bring special guests to focus on various important topics that affects our community and our community should know. Today's discussion is no different. We have Dr. Desouza here to talk to us about acculturative stress. But first, let me go ahead and introduce Mary and Anna. Anna and Mary, can you please introduce yourselves, please?
Hi, I'm Mary Moody. I am the Advocacy Director of Euskaya.
Thank you. And Anna?
Hi, I'm Anna. I attend Bowie State University, just giving insight as a college perspective on the various health topics.
Oh, wonderful. Thank you so much, Dr. Desouza. I will turn the mic to you. Can you please introduce yourself and the organization that you're affiliated with? Because, yes, go ahead and please introduce yourself.
So thank you so much for having me today. I really appreciate this opportunity to share with you all. So I'm Flavia Desouza, Dr. Desouza. I am a board certified psychiatrist. I can explain what that is, who is in child and adolescent psychiatry training. In my psychiatry training for adults, I did some special work with college students, graduate students. Now I'm mostly working with very young children, starting at the age of 2, all the way to the age of 18, and their parents. So, you get the child with the parent. I am affiliated with Howard University in Washington, D.C. I am one of the, yes, do you have a Howard affiliation?
Yeah, my sister-in-law, she's the lawyer. She graduated from Howard. My brother has a PhD in
That's right.
molecular science.
I didn't go to HU, but I always say HU, and I expect to hear, So I have an affiliation there. I'm a part-time assistant professor in the psychiatry and behavioral sciences department. I supervise training residents and work with medical students once a month on the weekends. And then I'm doing my child and adolescent psychiatry training at MedStar Georgetown. It's affiliated with MedStar and Georgetown University. And that's where I'm going to leave it. I am an immigrant myself from the diaspora. Yeah. I have to represent. Let me see how close I can get to the camera.
Oh, beautiful. Look at that.
Oh, beautiful. That's awesome.
For all of those who know that we crush every fast race, I see some of the Africans coming up though. Some of the Africans coming up in the
screen. Yes.
Yes. So I'm afraid.
No, don't be afraid. We are all the same people. Don't be afraid.
So there you have it.
But that's so exciting. Your plate is full. It sounds like you have no time. So we definitely appreciate your time tonight.
Yes, absolutely.
Yeah. But so tell us, what is acculturative stress?
Sure. I think the term that people are most familiar with is culture shock.
Oh, okay.
That's what I became familiar with when I came to this country. I never looked it up, but I always heard of this thing called culture shock. So basically coming into a new country or culture and really kind of experiencing some kind of shock, distress. Culture shock assumes that you're coming into just one culture, and that is only going to be a negative thing. Acculturative stress is a little bit different. So acculturative stress thinks about the interaction of two different cultures. So not just the culture that you're coming into. And it thinks about all the ways that it might affect your being. So it affects your mental performance, your physical health, it affects your sociocultural adjustment. The stresses can be social, it can be cultural, it can be familial, it can be environmental. So it's a much more kind of comprehensive way of thinking about the stress that people experience when they come in contact with a new culture, a new way of being.
Oh, that's deep. So I guess we all experienced at some point that,
Yes, all of us.
especially all of us that,
Yeah.
So in that regard, what factors affects, I guess the word would be, a culture, what is it? A culture,
Acculturative stress.
you're right.
Acculturative stress.
And I'm sure like there has to be some sort of important factors that have an impact on the culture, or acculturation. That's the word I was trying to say. Would you be able to tell us a little bit more about the effect of that?
Sure. So when you think about any kind of stress on the system, you automatically also think about supports. How is that stress buffered? If the stress is more than a person can handle, this is just a very basic understanding I think everybody can relate to, then it's going to come down on you. It's going to affect you potentially in a negative way. A little bit of stress is not bad, but if it's more than your capacity and more than you can bear, then it's going to be really difficult. So if you're thinking about lack of support, if you are a person coming for graduate education and you might be the only person like yourself from your background in your class, and maybe everybody else sees your customs and traditions as strange, that is more stress than if you're coming into community. If you're coming into like a family, or if you're coming into a larger community where they have events where you can feel connected back to your culture. If, for example, you're coming in and you were well educated, where you're coming from, you were well connected, you were well respected, and you're coming and you're struggling with not just the language, but maybe the idiomatic expressions, the cultural background of the language, the reference to movies, it could be many number of things that can actually also cause stress. And if you don't have a supportive environment where people are nurturing and they're helpful and they're looking out for you, it can become very difficult because it's difficult to communicate your needs or to be seen and heard in the way that you want to be heard. So your perception of support is decreased. If you have an underlying mental health vulnerability or medical vulnerability, it can increase your experience of acculturative stress. So if you have an underlying diagnosis or like a subclinical diagnosis of, let's say, depression and anxiety, this can kind of push you over the edge. And if you develop full-blown depression, or if you develop full-blown anxiety, you have less resources internally to deal with this issue. So it's a number of different factors, but if you think about really the balance of stress and support on the system, that's really what it boils down to.
That's really interesting.
College student, what are ways that like students can deal with acculturative stress?
I think one of the things that's important for anyone is to just have language and to be able to recognize what is happening. That's really the first step, and that cannot be underestimated. For many of us who have been here and who've thought about the different things that we've gone through, it may come very easily to us. But for people who are experiencing it, they may not even have a word for what they're experiencing. Or they may feel really isolated or upset or sad, or feel like it's difficult to relate to people, feel like they're being misunderstood, feel like they're not getting the support that they need. They may miss home terribly. Whatever it might be, they might be forming a new identity and they're not sure of who they are anymore because they were this person at home, now they're this person here. Just having a way to language the experience is the first step. Okay, what is happening to me is not unique, it is common. I can expect to experience this stress. It is a hard thing. For some people, it's harder than others. And then seeking appropriate help. And this is the harder part. So a lot of times, you have to educate me in terms of the college environment, but some temperaments, some personalities, some cultures might feel shame in expressing that something is going on or something they're having a hard time. Just even getting the ability to getting it out might be difficult. And then they might feel like it's a shameful thing, that something is wrong with them. It's phrased in a very negative way. So getting past that internal, maybe sometimes even cultural barrier to seek help, and then in seeking help of people who are compassionate, sensitive, informed is very, very important. Because you might be presenting with symptoms of like feeling stressed and anxious, And it is actually directly related to acculturative stress.
Right.
But on the surface, the person who you're seeking help from may just see it as anxiety and stress.
Yeah.
They may not ask you, okay, what was it like for you in your home country? What are the things that you're struggling with now? I mean, there's particular things. I dropped an article in the chat that a couple of us worked on recently, and there are specific questionnaires that clinicians and other entities can use to measure acculturative stress.
Yeah.
To determine how much this particular thing is affecting them and their mental health.
Okay, thank you.
That's a great point. One of the things that I thought about as you were speaking, being born African American, I know religion also plays a huge part in people just admitting that something is wrong with them. And a lot of times, like in my culture and growing up, people would say, oh, you could just pray it away. Or if you come down with depression, or you're really struggling with like this cultural shock or situation that you're in, it is almost frowned upon for you not to reach out for resources, or if you end up getting treatment, then you're deemed as being, in a sense, that there's something wrong with you for even reaching out and admitting that, hey, I need support in this area. And I think a great tool would be if, schools and counselors and, all of the people that work with college students and children that are coming from other countries, to really, really, like you were saying, to try to put things in place to understand the culture and understand the community that they're serving.
Absolutely. Absolutely. That is paramount, because the purpose of making a diagnosis is to treat. If you make an incorrect diagnosis, it's going to be very difficult to treat the issue. And that just goes across the board. If you're dealing with a symptom instead of a root issue, then you're really not going to be able to get to the root of the problem.
Right.
If I could take a moment to speak to this religion thing, I can speak from one particular worldview, and I'm going to speak about that. So I can speak from the Christian worldview. And I do think, I don't know where we've gotten this idea. Actually, I do know where we've gotten this idea. I do know. I do know where we've gotten this idea, because I was just reading about it. So there's a psychiatrist that I love. His name is Dr. Allen. He's a Jamaican psychiatrist, and he's developed a model called whole health and healing. And he is trained as a minister. So he has his Master of Divinity. He's an older gentleman, and I had the pleasure of sitting with him for a few hours, like in the last month or two, and he's a Christian. And how he thinks of the whole person is that we have many different parts of ourselves that are it's not just the sum of the parts, but they're all interconnected. So you have the physical, you have the spiritual, you have the mental, you have the social. And if any one of those things are off, it's going to affect the other components of the self. That's just a reality. That's just a truth.
Yeah.
The other thing is that we are not whole. So if you're thinking from this particular perspective, we have come into this world and the world is broken.
Right.
And we're broken and we're absorbing brokenness. It's going to have an impact on us. It's going to have an impact on the mental. It's going to have an impact on the physical. It's going to have an impact on the spiritual. It's going to have an impact on the social. And so the appropriate thing to do is to move towards a place of healing in all of those spheres of our lives, so we can function optimally, or as optimally as we can in this life.
Right.
So that's kind of one way of turning or, thinking about it a little bit differently. The other thing is that there are many places in the Bible that speaks to the expression of the emotion, and speaks to the expression of suffering, and speaks to the expression of things being difficult and it not being shunned. And there are also many places that speak to this idea of humility. So I don't know who has tricked us into believing or having this idea of shame, or having this idea of totally being perfect. That's just a false narrative.
Right.
We really have to get away from that, because what we're doing is that we're not allowing people to flourish and use their gifts in the way that they can maximally use them. Then on the flip side is that many of these experiences that we have in life are to teach us lessons. So if a person has a mental health issue, and this is one of the things I talk to my parents about who have mental health issues, they have something to offer their child. They can offer their child increased empathy. They can offer their child understanding if they're going through a hard time. They can think about structure in different ways. They see the world in a completely different way, and they have something to offer. Just because we have created a black and white, good and bad, it must be this way or that. That's just not how it works. We're diverse beings on this earth, and we have something good and beautiful to offer.
Yeah.
So, go ahead.
So I didn't mean to cut you off. Because I think cultural sensitivity is what a lot of people don't get.
Mm-hmm.
Right.
And when you don't get that, then you don't allow people to be themselves.
Right.
Because you don't understand someone's culture and upbringing and their morals and, things that make them, because a lot of times your culture really shape you. Your culture forms you. It forms your mind. It's how you've been raised. And if someone doesn't understand you, I faced this being African immigrant, like being born in Ghana and being brought here at a very young age. I faced all of that. I faced the questions about, in your country, this is what you do. Whatever they see on, what the media have portrayed about Africa is what they saw. And they didn't have any other understanding. They didn't understand that my whole family generation is really educated and are doing actually exceptionally well back home. Being here doesn't necessarily mean that I come from a jungle. It's when people don't understand your culture, who you are, then they have that preconceived notion and don't allow for you to express the way you flourish the best. And then they put that judgment. And so when you talk about how Mary mentioned about, having the church be involved, the thing is, I even want to ask this question: acculturative stress. Does every psychologist understands that? Or is it certain? So therefore, like, you have to teach you have to teach your providers who work with patients, right? Because they need to understand what that is. They have to have cultural sensitivity,
Right?
And understand how they relate to even their patient. And when that is broken, where do you go?
Really good
like this, you're gonna have that shortcoming. So I'm just glad you're touching on all the all the points, because I always advocate using the faith-based organization to get to our community. And how would these organizations get to the faith-based organization and work with our community if they don't understand the cultural sensitivity aspect of it?
Right.
That is so true. On the positive side, mental health is trending, and so are Black people.
It is.
Let's take advantage of that, because the reality is that, this is one small sliver, but lots of people don't even understand racism. They can't see it. And it's not just white people. Let's be real, it's Black people too, including some immigrants. And that's actually one of the things that's one of the things that contributes to acculturative stress, because you're coming from a majority Black culture, you're solidified in your identity, which is a good thing, and you're coming to a place and now it's confused. I actually had one patient who said to me, who was shocked. She said, here, color is not just skin deep, it's your whole identity.
The whole identity.
And so for some people, it's like that to them is the stress. It's coming into contact with that.
Yeah. I want to share one little story with you guys. Even in my own home, the experience was from my parents, who wanted so badly. I remember we came, when we got here from Ghana, I was very young. I think I started kindergarten here, but I remember we came in July. So the school year, we pretty much had been here a month prior to starting kindergarten. And I remember my mom and my dad the stress they put us on about learning how to eat the American food, because they wanted us to get used to eating the American school, because we were now about to go to school and we were going to have to, start speaking English, which I didn't know how to speak English. And they wanted us to learn how to eat the food because they wanted us to be able to eat the school lunches. And I remembered how stressed, as young as I was, I still remember that stress. I remember my parents putting so much stress on us, learning English, eating the food, the American food, and being able to look like Americans. All of that was a stress for us. And I just remember even a couple of days ago, my sister and I were talking about the impact that it had on us. It was very stressful. Even our own homes, we feel that by our own African parents, right, who came here. And I guess they were hoping that we're able to easily adopt by learning these things. So when by the school year, we're able to easily fit in and not feel that part of stress. But in that process, we were really stressed. And it was a stress that was really never talked about.
Absolutely.
Yeah.
Yeah.
What you're talking about is so common, because what the drive was, they were in their own way trying to protect you.
Yeah.
The drive was, okay, we need to change our environment. But what does that do to a child's mind and a child identity? It says, I am not okay.
Mm-hmm.
Something is wrong with me.
Mm-hmm.
I have to change who I am to be accepted and to be loved. I'm not naturally accepted and loved for who I am. So that's a messaging.
Yeah.
It's a repeated messaging.
Yeah.
And then it becomes complex, because this is really all of who you are. So you are both, especially for children who are growing up here. I mean, so it happens at all stages, especially for children who are growing up here. You are your parents, and then you also have aspects of who it is that you are here. I came to the States when I was 17, and there are things that I have adopted that are integrated into me.
Yeah.
And there are things from Jamaica that are a part of who I am, the way that I think. That's all of who I am, and that's a good thing. And so it's really tricky when this happens very early on in life, where a child is getting this message, because then it becomes integrated.
Yeah.
And then later on, it can result in identity issues. Lots of the kids I see come from families like this, where the parents are immigrants and there's one particular worldview. They're experiencing their own stress dealing in the United States with their own acculturative stress, the difficulty coming up against with their culture, coming up against this new culture and figuring out how to navigate it. And then they have these children, and they're not really understanding the environment that their children are coming up in. And so, the children have a different culture from the parents, and then there's also the stress of the culture clash in the household.
Yeah. Another big, amongst my peers about acculturative stress is the fact that, okay, immigrant parents, they come to America and they're like, oh, you have to be a doctor, a scientist, all of these other things. A lot of my peers are they're really having a hard time finding their identity, because it's what if I don't want to be a doctor? What if I don't want to be? I feel like that's another big topic that causes a lot of stress on people of the younger generation. And yeah, that's a really stressful topic as well.
Yeah, getting back to a point that Janet made about the eating part of it. So I was reading a research study where they talked about how women, more so than men, ended up with eating disorders. Because if you think about the stress from social media, all of these botched surgeries where people are really, trying to look a certain way. They are, not really eating, having to deal with, the stress from the outside world of what a woman's body is supposed to look like. You're supposed to look like the woman on the picture or the magazine, and so they don't feel beautiful inside or the outside because they're comparing themselves to someone that they see on social media. So that also plays a huge factor with all of the things that are going on in the world where women feel like they have to get, and I'm not, criticizing anyone, but they feel like they have to pretty much do a whole body makeover in order to feel accepted by society or feel wanted or beautiful.
It's what I like about your point is that you are bringing in that different aspects of culture.
Yeah.
So culture is not just simply what we eat or the music that we listen to or what we wear, but it is everything. It's our attitudes, it's our beliefs. And those are the things that are kind of underneath the surface that you can't readily see.
Right.
And that's a part of culture too. So you're talking about this part of culture that glorifies a particular look or glorifies a particular image. And it's the same idea, if you're coming up against it, and then what do you do with that tension that you're experiencing?
Yeah, I mean that. So, like, where do we get help? Like, are there organization targeting this? I mean, a lot helping us to understand how we're feeling. How I know mental health is something that, as you mentioned, it's really in the public right now. It's in the news, it's everywhere, and because it's affecting every one of us. And so what do we do? Like, how are we able to, like someone like Anna, I've gone through that stages where I'm an adult now and can like figure out as an adult how to channel my emotion and recognize certain certain stressors. If you're a college student, high school student, my son, how are they able to recognize what they're feeling and whether to seek the help at that point?
Yeah, so that's a really good question. The reason I said that, it was kind of a tongue-in-cheek, mental health is trending and Black people are trending, is because I think more and more people are becoming educated.
Yeah.
Whether they want to or not, because it's just coming up a lot. And while the term acculturative stress is not being used, people are recognizing that there are elements of cultures that are oppressive or are not healthy or are not helpful. And that we are in constant contact with culture, and there's that we have to be navigating that stress of not belonging or not fitting. I think the unique thing about acculturative stress is that acculturative stress takes into fact that people have a specific kind of experience when they migrate to the United States. So it's helping us understand, okay, that can be really quite difficult for a person to deal with. So in schools now, because I know as part of my fellowship, we have psychiatrists working in schools. They're clinics that oftentimes have social workers or counselors.
Okay.
So that might be a place to start. And oftentimes, if a person is able to recognize that's working in the clinic, this is best case scenario that they don't have the tools, they'll look it up or they'll reach out to a colleague, because there are so many professional mental health listservs. For example, you all at Uskaya might have your own listserv. As a psychiatrist, I'm on several different psychiatric listservs where I'm constantly talking and communicating with other psychiatrists, sometimes about these very things. So we're educating each other, but we're also seeking out help. So there's social workers in schools. There are community organizations. It's useful to get hooked into an organization where you can really flourish and feel like you can be yourself. So whether it is, whatever part of your identity, it might be your ethnic and racial identity, joining an organization that celebrates that and helps you really feel at home. It might be your athletic identity, whatever it might be. Find a place where you can feel like you are at home, where you have a sense of belonging, where you feel comfortable, where you feel like you can be yourself. So, I'm in the DMV area. I don't go out with this group often, but there's a group called Caribbean Riders. And it's a group of Caribbean people who like cycling.
Yeah.
That's basically it. However, they have 4 different WhatsApp groups for 4 different kinds of things. One of the WhatsApp groups is solely dedicated to socializing. That's all they do.
Nice.
They tell you when they're going to hang out, where they're going to hang out, and they invite people to come online. And then they also tell you about Caribbean events in the area. So if I were not a part of this group, and this is the truth,
Yeah.
I would not believe that there are any Caribbean events.
Yeah, it's true.
I would just not believe that because I'm not connected to a dense Caribbean group like that. Like I have Caribbean friends here and there, but this is a group where it's crowdsourcing of information. One person posts this today, another person posts this today. So getting involved, making use of social media in that way. That's how I like to use WhatsApp.
Yeah.
You know, so joining a group, joining a community, if you're in college, joining an identity-oriented group. Where
How
you
do you,
can, pardon?
I'm sorry. How do you go about like finding those kinds of groups?
If you're back in person in college, oftentimes they'll have these kinds of affiliated organizations. So they might have a cultural house, or you know, when I was in college, they had the Caribbean Students Association. They'll often have an African Students Association. Oftentimes the African Students Associations are actually quite active on campus. If they have, even if they have a small number, and they'll do things with the continent. Like I saw it with my African peers. They'll do gatherings here, they'll have their food, you know, so I imagine that they have similar kind of WhatsApp groups present. So that's what I would say if you're in the college setting. And then seeking out mentors or persons who are kind of a few steps ahead of you, who either can identify with your story or can empathize. So for example, somebody who has, even if they're from the United States, and this is why you shouldn't always judge a book by its cover. The person might be, you know, white as a lily flower. Are lilies white? But they may have grown up in Africa because their parents were like, did work there.
Right.
And might be real woke. You know what I mean? So finding people who are kind of like-minded, who are a couple of steps ahead of you, who can really guide you. Same for immigrants who are here. Hooking into a community. Okay, where do you get help? Where do you go to the supermarket? All of these things that are like hard to navigate because you just don't know.
I think too, also another good thing would be for parents, because I always worry about the youth and the children, because as Janet said, they can't really navigate through all of this. So I worry about them getting so stressed out where they start cutting, right? And so for our children, for our young children, I think it would be a good idea not only to educate the parents, but also have like support groups. You know, if like, you know, religious leaders get involved, they have, you know, support groups. There's some, you know, if they have a psychiatrist or a mental health worker that's in, that goes to that particular church, you know, maybe they can, you know, have, you know, give some insight, you know, give some training, you know, have a night, a fun family fun day night or something like that on a Friday night or a Saturday. And, you know, just have like a speaker for like 10, 15 minutes and just network together. I think that will also help the children and the youth, because once a kid is so hurting so much emotionally inside, it just leads to a spiral, out of control spiral. But if we can catch it early, you know, there won't be so many hospital admissions. There won't be so many children going to juvenile centers, being outplaced, you know, from the homes. You know, they can be able to be serviced right in the communities, and everybody can just like really work together to try to understand these different cultures and where they're coming from. I mean, I don't know too much, you know, I don't hear much about this as far as people from Africa doing, you know, the cutting and all of this other stuff. But I know, you know, in America, that it's a common thing, and people don't really hear about it, but it's very prevalent for kids to have that type of, you know, emotion where they're really hurting and frustrated inside.
All kinds of children do it, and I see it in all ethnic groups. Caribbean, you know, Caribbean, Latin American, and oftentimes with that and what you're talking about in terms of the carceral system, a lot of times it stems from early childhood trauma. You know, there are very many different ways that we could like spend 5 hours talking about trauma. And so I think what you're saying is really good, because oftentimes children put out warning signs or put out their emotions earlier, and they're just not taken seriously. You know, you know, or they said they're told to get over it, or they're soft, or they're weak, or they need to like, you know, when I was, you know, the joke that you hear people say, when I was your age, I used to walk up the hill both ways to school, and nonsense.
From a,
And
like
also,
a-
that doesn't mean that's okay. That does not mean that's okay. Like, I
Right.
would not want to walk up the hill two ways to school. That's okay if you did it. That's just not
From
for
a
me. I would like
young
to get a ride in a nice vehicle, you know?
Yeah, exactly.
Right.
from a
And
young
they have to
adult
also deal
perspective.
with bullying as well.
Right.
You know, like you weren't really bullied when we went to school. You know what I mean? Because there was such a sense of community. But now these kids have to deal with bullying. If a female is too pretty, or if their parents dress them too nice, then they have to worry about kids, you know, being jealous of them, picking at them, you know, and vice versa. If a kid is poor, live in poor neighborhoods, then they have to worry about, you know, the opposite of kids bullying them because they don't have, you know, the financial means to be able to keep up with the latest fashion. So it can be very complex.
So I would make one amendment to that statement. Based on the work that I do, bullying always kind of existed. It's just that now you have so many more media to bully in.
That's
You
what I
can
was
you can
thinking.
you
Oh,
can do
right.
cyberbullying. So
Yeah.
and that's even worse, because then you don't know where it's coming from, and it spreads
Yeah.
like wildfire on your phone.
Mhm.
So I
Right.
think that's the scary part. And then people get real embarrassed. They come to school and they're like, their face or their information is all over social media.
Yeah.
Mhm.
Yeah. I think because social media is a thing now, you do see a lot more, and you know, and obviously the awareness of it is now, you know, in your face, and that's why. But I think bullying is something that has always existed. I've seen it when I was growing up. I witnessed it. You're in the DMV, so you're familiar in the Hyattsville area, Delphi. It's like that's what I call the international of America. You have all sort of people, diversity. But yeah, I saw that. I saw the Indians bullying the Africans, the Jamaicans bullying the African bullying the Asian, you know. So you saw it all part. It wasn't in any particular group. It's just, I think it's just the nature of human beings. Just, you know, somebody always feeling more superior, and therefore they feel like they can bully you. So I think it's something that we're seeing and more because of social media. There's, you know, you people have access to be able to do that. I saw this one
Did we
Instagram.
did we miss a comment from our co-host?
Oh, wait, did you want to say something? Somebody wanted to say something?
Oh, no, it's okay.
Okay, all right.
Yeah, I was just gonna say I was watching one of those TikTok video, and someone, you know, she was a little bit heavy set and she felt so great about herself.
That's
And she
right,
had
girl.
phenomenal, like, you know, self-esteem, and she loved herself. And she posted this video, and then you have all these people saying these hurtful things.
Yeah.
And they were
Yeah.
only able to do that because they're in their homes where they can hide and they can do this bullying, right? It's because social media is everywhere and people can hide and throw a stone and never, you know, get caught. And that's why you see it a lot more. But Anna, I'm going to shut up. So if you have any question, please go ahead.
Oh, no, it's
Go ahead, Anna.
no, it's okay. It's okay.
Okay. So my follow-up question, just so I know, how are psychologists able to, or someone like yourself, able to assess or measure acculturative stress?
Right. So there are a couple different toolboxes. I don't know if the link that I shared is going to be publicly made available. People can access it.
We will make sure we put it on our website.
So there are different toolboxes. So basically in mental health professions, there are ways that we can screen very quickly to see if the person is likely to have an issue based on something else. So if you come into the clinic, they'll give you a particular questionnaire to see if you screen positive for depressive symptoms, or to see if you screen positive for anxiety symptoms, or to see if you screen positive for psychotic symptoms. In the same way, there are scales, acculturative stress scales, to see if this is an issue in your life. And the one that's cited in the article is called the Riverside Acculturative Stress Inventory. And they are looking at 5 different factors: work challenges in school, language skills, or work challenges or school challenges, excuse me, language skills, intercultural relations, discrimination, and cultural isolation. And there are particular questions that are given for the person who is the treater, provider, therapist, whoever, to explore with the individual and to kind of start to begin to ascertain, okay, is this something that we really need to be working on in our time together? Instead of just giving antidepressant. And I have nothing against antidepressant. I prescribe medications all the time and they help people wonderfully, but really trying to figure out, okay, what are the contributing factors for this person's presentation to my office, to my clinic? So for example, I'll give an example. One question might be, do you feel increased pressure as a representative of your culture? How does this affect your performance? So for example, you are going to school, you are from, your parents are Ghanaian, they want you to present a certain way.
Yeah.
Because this is how Ghanaian people are going to be seen, and you can't mess up. You need to eat like the people that you're going to be going to school with. You need to dress like them so you can blend in, and so you cannot be thought of as different.
Yeah.
Another thing might be, have you experienced conflict with others for? So if you are a child who was born in one of the countries in Africa, but came here when you were young and grew up here, I can say that for the Caribbean, and then you might meet somebody who migrated to the States later in their life. Are they teasing you? Are they saying that you're not X enough? You're not Nigerian enough? You're not Ghanaian enough? You're not Eritrean, whatever it is, enough. Yeah. What are your feelings of something called individuation from your parents? So individuation just simply means that a young person is coming to their own and separating in identity from their parents. They are having a sense of who it is that they are, how they're going to move in the world. How are you dealing with that as a child of an immigrant parent? What does that mean to you? Do you feel like you really can be yourself, that's unique, that's maybe even more American than they are, whatever that might be? Have you faced any discrimination in the classroom amongst your peers? What does that discrimination look like? Actively asking about discrimination.
Yeah.
Are there others who are in the same culture as you, around you? And how do you feel about that? Some people might be very happy that they're not with anybody from their culture. Other people really struggle. They might feel like they're not being supported. It's very strange here. They don't know where to go, what to do. They don't understand people. So that's a way of bringing that into the conversation.
Yeah.
So there are these few questions. They're not complex questions, but they're really guiding posts to help you bring this into the conversation with your client, with your patient, whoever it is that you're working with.
Yeah, as you was talking, I pulled up the article, and I think, Anna, this addresses the college students acculturative stress as to relate to college students. So this would be a great article for you to review. I like how it gives examples so that you can see for yourself. But this is really great. Thank you for sharing. I was able to just quickly kind of glance at it as you were going over.
The article is focused on somebody who identifies as Asian, but the principles actually remain the same.
Yeah. I assume it can, because that's still a foreigner here in America dealing with acculturative stress. So I'm sure it can be relatable no matter where you're coming from.
Mm-hmm. And many of these inventories are what we call validated, which means that they've been tested and they've been shown over time to help us pick up issues in this area. Yeah. And they've been shown to be understandable to many of the persons who are being asked these kinds of questions. Yeah.
This is great.
Is something, are these tools available for like schools, like in schools for like small children or, high school students? Like, are these tools shared with guidance counselors to see if they can help do some of the work? Like for an example, if a child is in therapy and they go to school, do the social workers in the school work closely with the psychiatrist or the psychologist and present some of these tools for them to complete with their families?
I would say I can hazard some guesses. I don't know, because I don't work in that capacity in schools, and I'm only exposed to very few schools, and I don't work in like the Department of Education, so I don't know. Yeah. What I can say is that I know personally that people are publishing on this now. So how to work with immigrant students in schools. And so the onus is on the individual who is in that position and their training entity to keep them up to date. Well, the entity keeps them up to date, but the individual to seek out information. So for example, as a practitioner who has the responsibility to care for people, it's important to me, especially if a person is coming before me and I'm not familiar with their background, their history, their culture, I need to do my own research. That's just good practice. I need to do continuing education. That's just good practice. You know, so I'm consistently reading, I'm consistently exploring. And if I don't know, I'll just ask. I'll ask my patients or I'll ask parents. You know, is this something that's important to you?
Yeah.
You know, do you want to speak to a practitioner who is XYZ? Why might that be? I'll ask them. So part of it is just learning to be, like what you're saying, culturally responsive, and as well as the term that we're using a lot now is cultural humility.
Yeah.
Really operating from a place where you recognize that you don't know all and that you need to have a posture of listening, a posture of empathy, and a posture of really trying to hear, not just hear. Like that's why I close my eyes.
Yeah.
Really attend to the person who's in front of you. I would presume, I don't know if this is true, but I'd presume that in the more diverse school districts, like racial-ethnically diverse school districts, that they might make some of these tools available to kind of keep up and to serve their students, but it's not something that I can answer definitively.
Thank you for that.
Over the years, do you think that like students have been, or just people in general have been dealing with acculturative stress better? Do you think like their environments have become like more accepting to and welcoming to them?
Yes and no. It depends on where you move to, right? If you're thinking about the United States, it's a good question. What I do think is being talked about and which might make it easier is that mental health is being talked about much more.
Okay.
So like the kids I see, the adolescents I see, like they like talk about these issues. You know, a lot of the schools that they're learning about these issues, they're learning about depression and they're learning about anxiety and they're learning that people take medications or they have friends who are in therapy or they know somebody who's taking medication. So I think it is much less stigmatized than it used to, especially for people who are coming up now, including in like, I want to say the Pan-African community.
Yeah.
It's still stigmatized, but I think it's less so.
Yeah.
You know, because I keep up with what's going on in Jamaica. Like it's coming into the music.
Yeah.
And if it's coming into the music, that's saying a lot, you know?
Yeah.
So to answer your question, but I think with the acculturative stress, that stress that exists no matter what, and not what happens with mental health issues. Suffering from something and you have no idea that you're suffering from it. So sometimes you might get depressed or you might suffer from seasonal affective disorder and you don't recognize what's happening. People around you don't recognize what's happening. It's the same thing with acculturative stress. You don't realize that this thing is impacting you. So I think just having more language to talk about it is going to help, but I can't say that I believe it's gotten better.
You know, I want to make this comment. I would say it's a whole lot big. It feels so good being African right now. Just being Black from Africa right now because our music is taking off.
Yes,
food, our culture. I mean, like if you go on Instagram, you're seeing a bunch of Ghanaian dishes. I mean, I don't know if since you're in the DMV area, you've heard of Anna, what's that restaurant that we love so much that you
Swahili Village.
Swahili Village. I mean, when you go, you're not only seeing Africans, you're seeing Indians and you're seeing Asians and you're seeing like, you know, regular white Americans, and you're seeing the culture is being embraced. Our music is everywhere. And I mean, people are dancing and creating you know, Instagram, you know, shout out to. So I feel like our children now, those that come now on board, or anyone that comes from Africa right now, isn't experiencing that culture shock that I experienced when I came here, because it's so much. you are so accepted now being African, and Africans are empowering other people to say, listen, we are people, and this is our culture. We love our culture. I mean, I'm so proud to wear my cloth everywhere I go now. And people are asking like how they can. I see a white lady at the grocery store in an African dress, and she looked phenomenal in it. So I do think that social media, music, Africans music is really, really has impacted it, the European, culture. I think it's more accepted now. So it's we can't hear you. Something happened to your mic. Talk again. You're now on mute, but we can't hear you. We still can't hear you.
Yep.
Now we can. Say something again.
I don't know what was going on before.
Yeah.
Yeah, we can hear you now.
Yeah, so what I was saying, I totally agree. I probably know like 2 African artists by name. Fela Kuti is one of them. And that's because I watched the Broadway show Fela.
Which one?
Fela Kuti. He is, I really think, was a trend-setting artist from the 70s, and they made a whole Broadway show on him, Fela Kuti.
Okay.
I agree with you. And I think we're in the age of information.
Yeah.
And we're in the age of a different kind of beauty, and embracing a different kind of beauty. Because just yesterday, I was like, I'm doing my research on clothes. So I like Googled fabulous work clothes. And I mean, there's several Instagram website pages that came up with like modern African work outfits.
Yeah.
I didn't Google African work clothes.
Exactly.
So when you think about that, Afro beats.
Yeah.
Beats are so popular in Jamaica. That's where,
Yeah.
So popular. People love it. And I hear it here.
Yeah.
Yeah.
So I definitely resonate with what you're saying.
It's exciting. I just love how we're, the world is changing, some for the better, some for the worse, but definitely it's as far as accepting other people's culture, recognizing, what makes someone feel better and accepting it. I mean, who are you to judge? I think that social media, although can be very
Netflix too.
Netflix,
with all the African shows.
Yes.
Really healthy African people. Because that's
even
we don't have any conceptualization, I think.
Yeah.
Visit. And
even
I
on
visited one country. Go ahead.
They were there was like a trend where everybody was trying fufu, and it was just like different races, different like cultures, and like saying what they thought about it. Like some people liked this, some people didn't, but it's all about like they're embracing our culture and like where we come from and stuff. So it was cool to see.
Yeah, absolutely. It's just so interesting. I wanted to ask you a question only because in preparation of you coming on our podcast, I read on Acculturative stress studies, and I came in contact with one that I felt it was really fascinating, was one that sort of examined the effect of acculturative stress on marital adjustment among African immigrants. And they recognized that the environmental stressor was much more, I guess it had more of a significant impact on relationship. Would you agree to that, or you've noticed something based on your ventures? Is it something that you feel is more of a significant impact on marital and the environment?
I mean, absolutely. It stresses the whole family. It stresses the whole family system.
Yeah.
So, I mean, consider this. Every aspect, even if you speak English, because I often think of Jamaica.
Yeah.
Jamaica, we speak English. almost every aspect of your interaction or expected interaction is different, including walking on the road, greeting people.
Yeah.
I mean, I have people who visit from the capital of Kingston, so the most urbanized area, who come here to the States and feel it's very cold.
Right.
Or feel that they don't have the natural support, the natural warmth that they have in their home.
Mm-hmm.
Extended family network to help with child rearing, to help bounce things off of each other. Increased economic pressures to potentially send back money home. All of those things, less time in the relationship, less time relaxing doing the things that the couple previously enjoyed, because now you're adjusting to a whole new place. So there's more stress on the relationship. I mean, all of that is difficult. If you have kids from the marriage, figuring out a whole new school system. Because everything about the US system to me is different from the system I grew up in Jamaica.
Oh yeah, absolutely.
Everything.
Absolutely.
And I am fortunate because I'm learning it from the inside out. But I sometimes have to tell my patients, you need to explain, like I had a patient who said to me, oh, we do English language arts. I was like, language arts? so I was like, do you mean English? And then the person said, English language arts. And then it turned out that we were actually saying the same thing, but I was like, why would you call this an art form? It's English. It's like English. I mean, so something as basic as that.
Yeah.
It's like, it's a little needle is a little thing that kind of pushes you over the edge. You know, you're in a married couple and you go out to work and people are disapproving of you and you don't have any outlet and you come back home and that is now in the relationship.
Yeah. I get it.
Yeah. Every aspect of, and then how you look is different.
Yeah.
Even if your country is more westernized,
Yeah.
dress is different.
Yeah.
The dress code, there is a difference, because when I go to Jamaica, the dress code, even for the people who like buy all their clothes in Florida,
yeah,
you move differently, you walk, your gait is different.
Right.
Because I can see it. I
Yeah.
can see somebody who's not from here, they just, their walk is different, how they move their body in space. So it's all of these things that you take for granted that are changes.
Yeah. This has been really interesting. When I heard you were coming on, I was really excited because I think that conversation needs to be had, and I think that we're not addressing so many things that we face as a community, as people, period. And it's so nice that you are talking to us about this, because I really never identified what I was experiencing as a child and even as an adult, because I remembered how I felt when the pressure was put on me, and I had to sort of discontinue what I was used to, what I like to do, all in order for me to kind of fit in that culture, right? That my parents thought was better for me, was going to help me better deal with the circumstances that I now have to face. So, and I'm so glad you're here to talk to us about that, because all of us are now going to be going back into conversation with people. You know how we always think that we're psychologists once we learn.
Of course.
I'm very sure now I'm going to be asking my son, it might be a acculturative stress that you're feeling now, TJ, but it's still really nice to have that education. So I appreciate you taking your time to explain what acculturative stress is. You gave us examples. You told us how, a psychologist would identify someone, and you've given us that key that we didn't have before, which is being able to even tap into our own feelings and say, oh, okay, so what I'm feeling is this, right? As an immigrant, that's what I'm feeling. So anyone that's able to watch this podcast should be now familiar with their feelings and how they're feeling about situations, especially if they're newly arrived. They don't even have to be a newly arrived immigrant. It can be anyone experiencing culture shock. And I love how you simply put it. You said really acculturative stress is another term is culture shock. And that's relatable. And that's what most people can understand. So thank you so much for coming on this platform and sharing your experience with us and teaching us and advocating for, mental health, because it's really needed. I will give you back the mic because I want you to make sure you say your final words and, anything else you wanted to say about
the one thing that I would like to say is we can't be okay all the time, and if you're not okay, it's important to find a person who is psychologically safe to share that with.
That's powerful.
That's really important.
Yeah.
And I can even see it sometimes in some of the people that I am working with, my clients. They might be reticent to say something, but I can see it. And so to find a space where you can just really offload and share and say, I'm having a rough time. This is just really hard. This is just really hard.
Yeah.
And that doesn't mean that the person needs to have a solution for you.
Right.
But to just be able to acknowledge it and to really be heard and understood is key.
Yeah. Well said. I think you hit the nail. You hit the nail on the head. Is that how they say it?
Yes.
Yeah.
But you're right. Just being able to express your feeling and knowing somebody hurt where you're feeling can be healing. And oftentimes you really don't need the person even giving you a solution. You just wanted them to hear it. But you're right. Voice out how you're feeling. And it's okay to feel sadness. It's okay to, to realize that what you're feeling is real and you don't need anyone's validation. You really don't. And that's what oftentimes we don't do.
Right.
We don't need someone to tell us how we're feeling, we should feel it. And I've always been a believer of this, and I tell my younger sister all the time, you have someone telling you this is how you're feeling and you're trying to justify. You're not hearing them. Validate it. Let them know, you should accept, I hear you. This is how you feel. And that's all they need. And you're trying to tell them how they're feeling and justify how they should feel. And that's I think can even be worse for that.
Yes, it can be hurtful.
Yeah.
It's really hurtful, especially if a person has made themselves vulnerable.
Absolutely.
To share.
Yes.
Absolutely.
It's important to honor the person's vulnerability.
Yeah.
Because they've taken a leap of faith, they've taken a courageous position to come to you and to share. And we need to break these cycles of shame and being mean-spirited and unkind and telling people that they need to pull themselves up by their bootstraps. That's not, we're community-oriented people, Black people.
Yeah.
We're community, and we need to really live into that.
Yeah.
So.
Yeah. Well, thank you
so much.
Then Anna, Mary, any last words? You have a comment to make before?
I just really, I enjoyed this conversation. I liked it.
I'm glad you could join us.
Thank you.
Young people in the house.
Yeah.
Yes, I really, really appreciate all of the knowledge that you shared with us tonight.
Yeah.
I'm really, really happy that you decided to join us on this topic. And my hopes is that we can come together and talk about, the stressors as well for our men. Because oftentimes we talk about, mental health, we talk about these other things, but we really don't talk about how our men are suffering, and they need a lot of support too. So I would hope that we would definitely, talk about our men in a future conversation.
Yes. So thank you all so much. I appreciate each one of you, your insight, your questioning, my co-host, Dr. Desouza. Thank you so much. You've been so pleasant to have. I appreciate
my pleasure.
Because looking at all the involvements and you still made the time for us, we're so welcome. And Mary pointed out too, this is something that we need to have a continuation on addressing the concern that Mary raised, which is the man, because it is oftentimes a subject that we don't touch, right? So that's something we definitely hope that you will definitely revisit us. And then hopefully we can dive into that conversation as well. But I thank each one of you. Thank you so much. And we appreciate you all. But we will end the podcast now. Thank
All
you.
right.
Thank you.
Okay.